After that, I came back in Italy to finish my residency, and I started the other project with a startup based in Turin named 3D Medics. And in collaboration with Professor Porpiglia and other colleagues, we wrote a lot of papers on this specific technology and the use of this specific technology in partial nephrectomy. Actually, my end residency project deal with this kind of technology, and we show how the trifecta, that is a rate of success of the procedure, is way better with the 3D virtual model application during the surgery than without. And
Angela, sorry to interrupt you. You have clearly a very important background and CV. What would be your project if you were accepted in this PhD program? In few words, what would you like to study?
So the 3D virtual model is always been used in robotic surgery. My idea is to use it in laparoscopic surgery, and actually we will present an abstract because the 3D Medics developed this 3D icon system, which can let the surgeon to use the 3D virtual model during laparoscopic surgery. This is possible because we use a touchless, an infrared-based sensor who read the movement of the hand of the surgeon, and the surgeon during laparoscopic surgery, so also if he's sterile, can manipulate the model. It is very, very useful because for the operative planning, but also for the clamping strategy and for resective and reconstructive strategy. So we have a screen with half there is the model, and the other half there is the surgical field, and you can interact without the need of an scrubbed assistant. This is mentioned, and yeah.
Okay, thank you very much for your project and for your presentation. And again, like your colleagues, we will shortly have the outcomes of this examination.
Very good.
Bye-bye, Angela.
Now we have Dr. Chestnut Ivan. Hello, Ivan. Did you hear us?
Yeah, hello, I hear you.
Introduce yourself to the planning of your research.
So, may I use my presentation for my oral listening? No?
No, we didn't allow anybody. We apologize, but it takes some much time. Just tell us a few words about your background, your education and research experience, and synthetically what you would like to pursue.
Yeah. Okay.
Thank you.
So, okay, I've worked in different places, and I mastered a lot of important methods for my potential PhD project. So I graduated in biomedical science, and so I want to start with my pharmaceutical experience. I worked on the creation of SARS-CoV-2 vaccine development, Convacel. It's a registered vaccine. So during this experience, I worked with preclinical research, worked with animals, and so on. So about my scientific background, my master thesis topic is acidity and impact on the structure and properties of amyloid fibrils. And in a nutshell, beta-2 microglobulin can form amyloid fibrils during chronic dialysis in people with kidney failure, and the possible mechanism can be metabolic acidosis. And we found out that decrease of pH lead to amyloid fibrils formation, rather than in natural pH we have non-specific aggregates, and amyloid fibrils formation emergent energetically more profitable than aggregates formation, so it could be a possible mechanism. So after my graduation, I'm working as an electrophysiologist on a couple of projects, and one of them is verification of INAC channel's functional activity for new isolation protocol of endometrial mesenchymal stem cells isolated from menstrual blood. I confirmed this presence of these channels using immunofluorescence staining using patch clamp, cell-attached patch clamp, I found the typical conductivity and reverse potential, and make experiments with typical activators such as tachlazine D and trypsin. So, and about my motivation, the most important part, I took part in the different projects, but none of them related with cardiovascular system. But actually, I'm really interested in this area, and it's a reason why I start mastering patch clamp and other related methods. And simultaneously with that, I'm searching for a suitable laboratory and find this laboratory in Imperial College London. I connected with Professor Gorelik, and actually I even participate some laboratory meetings.
Even are you working on an isolated myocyte?
No, I've never worked with isolated myocyte, but I worked with other types of cell, and I have related methods such as patch clamp, which could be possibly important.
Yes.
So, and me and Professor Gorelik find the most interesting topic for me is gamma-related cardiac function. So typically it's related with inhibition of hERG channel, which is lead to normal prolongation, arrhythmia, and other problems. And also we found a laboratory of Emilio Hirsch where doxorubicin-related cardiac expansion are researched right now, and they found the possible mechanism of PI3K signaling regulation, which lead to immune with delayed tumor growth and reduced cardiotoxicity. And based on the literature data, I know that PI3K signaling is a regulator for different ion channels include hERG channels in calcium 1.2, which is a subunit of LTCC channel, slow calcium channel. So, and in Imperial College London in 2016, Professor Gorelik found out that during heart failure and loss of T-tubules Faustino, LTCC can dislocate to the surface of sarcoma, which is unusual for cardiomyocytes. They have a high open probability phosphorylation status and lead to arrhythmias. So we have a different mechanism like of channel inhibition, channels overactivation, and channels dislocation, and could be a huge mechanism which is still unknown, and it could be my potential project with collaboration of three universities: Imperial College London, University of Turin, and University of Verona. And this project can help to
Very good, Ivan.
adjust the treatment. Okay, thank you.
Thank you.
Thank you very much, Ian. Okay, we'll keep in touch. So then we have Dr. Tibebu Solomon. Dr. Tibebu Solomon, we see you. We cannot hear you yet. Then we have Dr. Twin, and we'll go back then to Dr. Moitama. Okay.
Hello, I'm hearing you.
Yes, please introduce yourself and tell us about your project.
Thank you, sir. Okay, my name is Dr. Solomon Tuwabu. I'm currently working at Addis Ababa University in the faculty of College of Medicine in the Department of Anatomy as Anatomy, Embryology, and Histology lecturer for the last about 10 years. And I'm also a medical doctor. I'm currently working as a general practitioner in the hospital. So my academic background is I have a bachelor degree in biology, and I have also a master's degree in anatomy, and I have also MD degree. And my research project was on traditionally used medicinal plants on experimental animals. The topic is an anti-fertility project. The topic is the anti-fertility effect of the methanolic root extract of a traditionally used plant in Ethiopia, and the research objective is to evaluate the safety and efficacy of the extract on experimental animals. And my part was to investigate morphological changes and biochemical on some biochemical parameters, which is on glycogen extraction from the uterus of the rats, and the quantification of the glycogen content using spectrophotometry. And the other part of the research was on the histological changes, follicular development in the ovary, and also on the uterine histology on the rats. And my final finding was that the extract has some potassium or atrophic effect on the uterine histology, and also on the changes on the glycogen content of the uterus. So my future research interest was on cardiovascular research, mainly focusing on the mechanism of atherosclerosis, on finding some alternative ways to make diagnostic and therapeutic interventions, alternative interventions. And for that, I have much interest to pursue on that line, and the other one is on the regenerative medicine. Since I have taught embryology for the last few years, and I have much interest. I have inspired on the stem cell, on the embryonic stem cell culture. Using that methodology, I have an interest to develop, to engage in the regenerative medicine part.
Okay.
Okay.
Thank you very much, Dr.
Thank you.
Bye-bye. And we move on now to last but not least, next to last, Dr. Marco Zuin.
Good morning. Good Marco.
Yeah, we do it. Yes, we will do you. You connected, sorry, apologies. We do Dr. Zuin, and then we'll do Dr. Moitama. Okay? Stay with us. Please, Marco.
Thank you very much. I'm a medical doctor. Actually, I'm working as assistant professor in cardiovascular and internal medicine at the University of Ferrara. I'm a fellow of the American College of Cardiology and European Society of Cardiology, and I'm also invited lecturer at the University of Zurich for cardiovascular medicine. My research field range from acute pulmonary embolism, the treatment of percutaneous treatment of occupation for adenomale, and the treatment of left main bifurcation, and also the application of computational fluid dynamic analysis in conjunction with Professor Migliavacca, which is the chairman at the Politecnico of Torino. I served as a research fellow, obviously, in the University of Ferrara, and also at the Department of Cardiology of Rovigo under the mentorship of Dr. Roncone and Professor Rigatelli, and actually published about 2,500 manuscripts in the mathematics. My topic of further research is mainly based on resolve an acute problem regarding the treatment of acute pulmonary embolism, and especially to identify the optimal window for the administration of systemic thrombolysis, either systematically or using percutaneous treatment. Because at the current state of the art, the current guidelines, despite recommending systemic thrombolysis in hemodynamically unstable patient as class 1A, they recommend that you can perform the procedure until 14 days from the site of onset. But because it is the third cardiovascular mortality in Western countries, and for acute myocardial infarction and for stroke, there are specific time windows for the administration of systemic thrombolysis. I believe performing some preliminary studies based on monocentric cohort, that the earlier administration of systemic thrombolysis could significantly improve the short-term mortality of these patients. Also, I'd like to investigate whether the modification of the thrombus by computational hemodynamic analysis can impact on the response to systemic thrombolysis, because it seems that the modification of the shape of the thrombus is a major factor for predicting the results of the systemic thrombolysis or percutaneous
Okay. Thank you very much.
Thank you very much.
Thank you.
Okay, so now we close with Dr. Moitaba Kandepir. And your colleagues, you introduce yourselves and tell us short about your research.
Good morning. I hope you are well and healthy. My full name is Moitaba Kandepir. I was born in 1999 in Mashhad. It's a city in Iran. I have a master's degree in sport injuries and corrective exercise from Hakim Nizami Institute. My research is in the field of cardiovascular endurance in sports and corrective exercises. I examined the impact of age of corrective games and basic skills training on mental health of the sports aged 7 to 10 years with mild depression. Interested and works including cardiovascular exercises in sports, cardiac disorders, and nervous function mechanisms. The relation, can you hear me?
Yeah.
The relationship between stroke in exercise and cardiovascular disease and heart rate has also been investigated by me. I also researched mental health and sports handball injury in the lower limb. I teach cardiac physiology in several Iranian universities. I work in my professor Hassan Danishmandi. With a keen desire to expand my knowledge about cardiovascular science, my main reasons for developing appropriate medical treatment and prevention methods for heart disease, I decided to continue my studies in cardiovascular science. This is my desired career path. Considering taking advanced course in central nervous system physiology, human physiology, heart physiology, and human anatomy, I consider myself ready and interested in working on the field of cardiovascular science, and I will succeed in that. I like your university approach to this field because Verna University cardiovascular science facilities are more than another universities. I become fascinated by your work in this field of study. Therefore, I quite enthusiastic about joining your research team as a doctoral student.
Okay, Doctor. Yeah.
Thank you very much, Dr.
Thank you very much.
Thank you. Thank you.
Can I wait? You need to do my internet connection page and I want to use this computer.
Abbiamo già sentito.
Ma questo è way to